Alright, welcome to Labs 15 and 16. This is also going to be AV Unit number 7. Once again, this one's going to be broken up into two distinct portions. Lab 15, which corresponds to the hip and thigh, and Lab 16, which corresponds to the leg and foot. Alright, just some key terminology that we need to review. Hopefully you guys still remember this stuff from our last unit over the muscles. The origin point, if you recall, is the point that does not move when a muscle is contracting, whereas the insertion point is the point where a muscle does move when a muscle is contracting. We also have the synergist muscle, which is a muscle that aids in that prime mover's action, and then the antagonist muscle, which actually opposes the prime mover in its action. Alright, what will you need to know for the hip and thigh muscles? You'll need to know origin, insertion, and action, as always, for the following: Iliopsoas, Adductor longus, Adductor magnus, rectus femoris, gluteus maximus, biceps femoris. And then, once again, any of the other muscles that we talk about, you'll need to know their action and be able to identify them as well. For the leg and foot muscles, you're going to actually have to know the origin, insertion, and action for the gastrocnemius, tibialis posterior, flexor digitorum longus, tibialis anterior, and the extensor digitorum longus, and then fibularis longus. There are a couple muscles for you guys that we can leave off in this unit, and that's the flexor hallucis longus and the extensor hallucis longus. And as I just said, you'll need to know then at least one action and also be able to identify any of the other muscles of the leg and foot that we discuss. Alright. Just like we broke down the arm and forearm, we can actually break down the lower extremity into the thigh and leg. The thigh is really the region of the lower extremity that's going to be superior to the knee, whereas the leg is the region that is going to be inferior to the knee. And we're just going to get right into the muscles. The first muscle that we're going to talk about is the iliopsoas muscle. The iliopsoas muscle is actually comprised of two separate muscles, the iliacus and the psoas major muscle. The origin point of iliopsoas is thoracic vertebrae number 12, and then your lumbar vertebrae. The sacrum, there's a portion of it, of really this portion of this muscle, specifically the psoas portion that attaches there. And then the iliacus portion of this muscle attaches to something called the iliac fossa. Now you know why it gets that name. The insertion point of this muscle, the iliopsoas muscle, is the lesser trochanter of the femur. Action of the iliopsoas includes flexion of the thigh and then the lumbar vertebrae as well. So flexion of the lumbar vertebrae. All right. One of my all-time favorite muscles ever, Sartorius. This is the S-shaped muscle found within our body here. It's really cool, very easy to distinguish. Origin point of Sartorius is the ilium. The insertion point is the shaft of the tibia, and then it has a wide range of functions. For instance, aids in flexion, lateral rotation, and abduction of the thigh, and it also flexes the leg itself. Alright, the next muscle we'll look at is the gracilis muscle. It's a relatively long muscle found within the lower extremity. Its origin point is the symphysis of the pubis, and then its insertion point is the proximal medial tibia. Actions of gracilis include adduction of the thigh and flexion of the leg. The next two, pectineus and adductor brevis. Origin point here is the pubis, specific portion of the body and superior ramus of the pubis, and if you remember, that's just a portion of the os coxae. Insertion point for pectineus and adductor brevis is the posterior femur. Their actions, here I'll speak about them separately. Pectineus action includes adduction and flexion of the thigh, whereas adductor brevis includes adduction, flexion, and also lateral rotation of the thigh. All right, adductor longus, adductor magnus. Adductor longus origin point is the pubis. Its insertion point is the linea aspera of the femur. And then the action of adductor longus includes adduction, flexion, and lateral rotation of the thigh. Adductor magnus, its origin point is the pubis and ischium. Its insertion point is the gluteal tuberosity and linea aspera of the femur. Well, its action includes adduction, flexion, extension, and lateral rotation of the thigh. All right, what four muscles make up the quadriceps? The quadriceps are going to be comprised of the following. A muscle called the rectus femoris. The rectus femoris is the most superficial of the quadriceps muscles. Then we have something called the vastus lateralis. This is the most lateral quadricep muscle. Then we have the vastus intermedius. The vastus intermedius lies directly under or deep to the rectus femoris. So if we were to reflect the rectus femoris, meaning we were to cut it out of there, we could then stare at the vastus intermedius. The next and final quadricep muscle that we'll discuss is the vastus medialis. It's the most medial of the quadricep muscles. All right, now we can actually talk about them in greater detail here. Rectus femoris. The origin point of rectus femoris is the anterior inferior iliac spine, and then the portion of the acetabulum, which is called the margin of it. So it's just a margin of the acetabulum there. And if you remember, that acetabulum was found on the os coxae. The insertion point of rectus femoris is the tibial tuberosity by the patellar tendon. Action of rectus femoris includes flexion of the thigh and extension of the leg. Vastus lateralis and vastus medialis action includes extension of the leg. All right, now to the deep quadriceps muscle, the vastus intermedius. Its action also includes extension of the leg. And what they're showing here in this image is actually the reflection of that muscle of the most superficial quadriceps, showing you then the vastus intermedius. All right, now the gluteal muscles. We actually have three distinct gluteal muscles: gluteus maximus, gluteus medius, and then gluteus minimus. You're going to need to know the origin, insertion, and action of the gluteus maximus muscle. Origin of gluteus maximus includes the outer iliac blade and the iliac crest of the os coxae, then the sacrum, and then the coccyx itself. Insertion point is the gluteal tuberosity of the femur. And then action of gluteus maximus includes extension, lateral rotation of the thigh, and it also braces the knee. Gluteus medius and gluteus minimus, you don't need to know the origin insertion, but the action includes abduction and then also medial rotation of the thigh. All right, TFL, tensor fascia latae. This is a really cool muscle. I think this one pretty interesting because it runs in conjunction with the IT band, the iliotibial band, if you will, and it's a pretty difficult muscle to point out on a cadaver. So I'll bring that up in lab and we'll practice a little bit identifying TFL on some of the models that we have. And maybe I'll even bring in an online dissector so you guys can actually see what this muscle looks like in a cadaver when we, maybe we can use the computer to do that. All right, so tensor fascia latae. The action of tensor fascia latae includes flexion and abduction and medial rotation of the thigh, but it also allows stability of the knee joint when it is extended. So when the knee is extended, it aids in actual joint stability for the knee. All right, now on to the posterior side of the leg. What we're going to be looking at here are our hamstring muscles. The hamstring muscles, really there's three of them. We have the biceps femoris, the semitendinosus, and then semimembranosus. All three of them function to extend the thigh and actually flex the leg. Origin point of biceps femoris includes the ischial tuberosity and linea aspera of the femur. And then the insertion point of biceps femoris is the head of the fibula and then the lateral condyle of the tibia. All right, as I've said, what are just some other terms that we need to review? A synergist and antagonist. Synergist aids another muscle in the same action, whereas an antagonist opposes the muscle in terms of its action. So a couple examples of those that we can talk about here. We'll look at the rectus femoris. Rectus femoris' action is actual flexion of the thigh. So the synergist muscle here is going to be Sartorius. So action of it, flexion of the thigh. Notice this action aids the rectus femoris. They're both flexing the thigh. The antagonistic muscle here is the semitendinosus. It's a hamstring muscle, if you recall. Its action is extension of the thigh. Look at that now in terms of it's actually opposing what the original action was doing, was flexion there. So this is just another example of synergist versus the antagonist muscle. Hopefully you guys realize that the rectus femoris would be considered our prime mover in this case here. All right, and that's it for the upper portion of the lower extremity. Now what we'll move on to is really lower portion of the lower extremity.